Hi there, welcome to my in-depth video on celiac disease. I also made a shorter, more to-the-point video. You can find the link in the description if you're interested in that one. And let's get into it. In a nutshell, celiac disease is an autoimmune disorder where your body makes a reaction to gluten proteins which hurt the small intestines. It's most commonly starting in children from 6 months to 2 years, and its prevalence is 1 in 100 to 1 in 170 children worldwide. And the destruction of the small intestine causes mostly gastrointestinal symptoms. Let's start with the pathophysiology. People, 95% of everyone with celiac disease has HLA-DQ2 or HLA-DQ8. These are genes that code for the MCH2 antigen presenting receptors, and those receptors make a little too tight connection with the gluten proteins, which leads to T-cell activation and inflammation. Among gluten proteins are gliadins and glutenins, and they are found in grains like wheat, barley, rye, and oats. So when the MCH2 binds to the gluten, it will lead to T-cell activation and to an autoimmune response, which in turn disrupts the structure of your intestines and the function of the small bowels, which will lead to malabsorptions and villus atrophy. Here I added a picture where you see the normal mucosa with the villi, and it will slowly lead to a villus atrophy, which is not functional anymore. Classically, it will lead to those symptoms: a pale, loose, greasy stool, weight loss or failure to drive, fatigue, and anemia. But if we look in more depth, we can see these three categories: gastrointestinal symptoms, malabsorption-related symptoms, and miscellaneous category. For gastrointestinal symptoms, we have the diarrhea, abdominal pain, cramps, bloatiness, mouth ulcers. Someone can be lactose intolerant because the villus structure of your intestines is damaged, and therefore the breakdown of lactose cannot happen. And because of the chronic inflammation by eating glutens and having a constant autoimmune reaction, may increase the chances on an adenocarcinoma or lymphoma in your intestines. So this is important for your long-term prognosis. Then malabsorption related, because your villus intestine structure is damaged, the reuptake of all nutrients is not so good anymore. So carbohydrates and fats may not be as well absorbed, so it may lead to weight loss or failure to thrive. You can get anemias by deficiencies of iron, folic acid, and vitamin B12. Can have osteopenia or osteoporosis, if it's even more severe, because of calcium and vitamin D deficiencies. And lastly, you can have deficiencies in selenium, copper, zinc, and vitamin K. And this may lead to increased bleeding tendency. Then the last category, miscellaneous. Here it's unclear if there is a causative factor in the genes that cause celiac disease, or if they have the same shared predisposition between all these diseases. So someone with celiac disease has more chances on getting any of these: IgA deficiency, dermatitis herpetiformis, growth failure, pregnancy complications, even leading to miscarriages, hypersplenism, and abnormal liver function test. And it's still unclear if celiac disease is the cause or that they have shared predispositions. Then, regarding the diagnosis, it's difficult to diagnose celiac disease. It often takes very long because the symptoms are not clear, and then when the destruction gets more severe, then it becomes clear, but this takes months. It's also important that someone keeps eating gluten, because as soon as you stop eating gluten, the autoimmune response isn't there anymore, and your villi start to heal, your intestines start to heal, and your symptoms will get less. And if you start your diagnostic process then, you will never see the damage that celiac can cause. so it's impossible to diagnose when someone is not eating gluten. So take that into consideration. The first step would be blood test. You can do an EMA test because it's high specificity. You can do an anti-TTG test for its sensitivity. And then you always do a total IgA, because some of the people with celiac disease can be IgA deficient, as we saw earlier. And if this is the case, you also need to determine the anti-DGP, because this will help you to furthermore specify if someone has a celiac disease or not. Then you can do an upper endoscopy, and this will show you scalloping of the folds, mosaic pattern, and prominent blood vessels, as you can see in this picture. And then while you're doing your endoscopy, you also take a biopsy of the duodenum. And if you see step 3 or 4, then it's very clear that you have villus atrophy based on celiac disease. So this can really help you by making the diagnosis. Then you can do some blood assays to check for the deficiencies we already discussed: iron, folic acid, vitamin B, hypocalcemia, and hypothyroidism. You can make a DEXA scan to see if there is already osteopenia or porosis. And lastly, if you still don't know it, you can always try a gluten withdrawal. And if the symptoms lessen and someone gets better, then it's quite clear someone has a gluten disease. So the treatment, it sounds simple: lifelong gluten-free diet, but it's way harder to do. Someone don't eat gluten anymore, your intestines will heal because the inflammatory process will stop, and this will of course resolve all the symptoms. But the problem is the gluten-free eating itself. It's often not that tasteful, it's hard to get, and it's more expensive. So people with celiac disease often cheat their diet, which may cause the celiac disease to proliferate again and give them symptoms again. So that's one of the parts that makes it hard. The other one is that gluten-free food still possesses at most 20 milligrams per kilogram gluten, so it's not zero. And it's unclear if this can also proliferate your celiac disease. Some recent studies have shown that as much as 10 milligrams gluten a day will not lead to proliferation of your celiac disease, but it's still all quite uncertain. So I would take that in consideration when a patient keeps having symptoms while eating gluten-free. So this was my in-depth overview on celiac disease. If you have any questions, please ask them in the comment section. I also made a more shorter to-the-point video. Feel free to check that one out and subscribe for more content and new videos soon. Thanks for watching.